We'll start by noting that today is National Interpreter Appreciation Day. So I want to thank all sign language interpreters, to include Gail Coronado, who is with us today. The hard work that they do to facilitate the communication of important information to Louisianans who are part of the deaf or hard of hearing community is extremely important, and I want to thank you for your service. Before I get to the COVID update, I did want to note that I'll be happy tomorrow to welcome President Biden back to Louisiana. He will be visiting Lake Charles and then New Orleans to discuss his infrastructure plan. And personally, I can't think of a better place to do that. And it is incredibly important that we invest in infrastructure here in Louisiana and around the country. I'll be joining the President in Lake Charles tomorrow at the bridge. And again, this is fitting. Infrastructure in Louisiana, roads and bridges, have been given a D+ grade. Louisiana has 1,634 bridges in poor condition. Later that day, he will tour water and sewer infrastructure in New Orleans, and he will see firsthand the struggles that we face, as more than 50% of our water systems have infrastructure that is at least 50 years old. It's also critically important for the President to visit Lake Charles, because we are still rebuilding from Hurricanes Laura and Delta, and much assistance is required, and that assistance really can only come from the federal government. The storms were last year, but we are still fighting for our communities and our families so that they can fully recover, and that additional federal support, especially in terms of a disaster appropriation for the permanent housing and resiliency that we need to be engaged in Southwest Louisiana, is incredibly important. I will also be thanking him for Louisiana's funding from the American Rescue Plan. As you may remember, last week on Thursday, I announced our plan for the use of those dollars, and it's very heavy on infrastructure. So that will, I think, tie in very well with his visit as well. Another priority that we announced is jumpstarting tourism again in the travel industry, which, as we all know, took a huge hit last year because of the pandemic. I've declared this week Travel and Tourism Week in Louisiana to bring attention to this vital industry in our state. I think we have a once-in-a-lifetime opportunity to take this substantial funding, $3.2 billion in total for the state, $2 billion for local government, and put it to good transformative use. And you really can't do that if you divide it up dozens of different ways, because you're not going to have enough of an investment in any one area to have that transformative impact that we're all looking for. And so I think the plan that we laid out is a very smart use of one-time funds. That plan was developed after consulting with people all across Louisiana, in every nook and cranny of our state, talking to the state agencies who oversee efforts related to water, to sewer, to infrastructure, and so forth. And I look forward to sharing these priorities with the President during his visit. And now we'll get to COVID. Today we're reporting 459 cases on 17,686 new tests. Very sadly, we're also reporting more deaths. 13 more deaths today. The total now is 10,418 since the start of the pandemic. We currently have 338 COVID-19 patients in the hospital. That is an increase of 21 from yesterday. 33 of those patients are on mechanical ventilators, and that is a decrease of 5 from yesterday. Right at 27% of all Louisianans are fully vaccinated today, and 32.4% have at least one shot. 35% of all adult Louisianans are fully vaccinated, and 42% have at least one shot. Louisianans 65 or older, 68.5% of them are fully vaccinated. and that's a good number. But that means 31.5% are not. And so we've got to continue to work, not just on the older Louisianans, but on all Louisianans, because we need people to be vaccinated in larger numbers and quickly. But it's really important that not only that everyone get vaccinated, but those more vulnerable because of their age or health condition to COVID-19 are vaccinated. Because when we do that, we can be reasonably sure that we won't have the run on the hospitals that we had in the past when we had surges. And remind you again, we had well over 2,000 in the hospital at one time early in 2021. But we also won't have as many deaths because the way this works is you get positive one day, you get sick a few days later, you go in the hospital after that, and then you die after that. And so you have lagging indicators. But at the end of the day, if you want to get to a zero death count, you got to have a positive impact on the front side of all of that. We can do that now through vaccinations, as well as continuing to slow the transmission of the virus. So it is extremely important that everyone get the vaccine, including younger people, because young people, by the way, often get sick. But even if they don't, they become contagious and they can continue to spread the virus to other people who will, in fact, get sick and be one of the ones who end up in the hospital or worse. I can tell you that I'm very excited about the fact that on Mother's Day, this coming Sunday, I will be able to personally visit with my mother inside, without distancing, without masks, because she and I are fully vaccinated. And so that Mother's Day celebration will look like Mother's Days of the past and not Mother's Day of 2020. That's something that's available to all of us, and we can do it safely. I'll know I'm not giving her the virus. She'll know she's not giving it to me, and we can relax and have a Mother's Day like we all should desire. And so I encourage people, not just because of Mother's Day, but for any opportunity that you might have to get together with individuals and celebrate, please get your vaccination. The sooner, the better. We have 3 safe and effective vaccines, and they're available at more than 1,500 locations in Louisiana today. If you need to find a provider for a shot, if you want to ask a question to a medical professional about the vaccine, please call our hotline at 1-855-453-0774. Again, that hotline is available to schedule appointments, to find a provider, or to ask questions of a medical professional if you have questions. We want you to be confident about the vaccine. We know and believe that they are all safe and effective. We want you to feel that way as well. So please call that number, 1-855-453-0774. The federal government has also launched several useful tools for finding a provider. One way is to text your zip code to GetVax, GETVAX, and that number is 438-829. Again, text your zip code to 438-829, and it will send you a list of providers in your immediate area. The list can also be found on vaccines.gov. I do want to make you aware of some new operating hours for the community vaccination site in Baton Rouge. Starting this Sunday, Mother's Day, May the 9th, they will be closed on Sunday and Monday and open 10 a.m. to 6 p.m. Tuesday through Saturday. There's also a vaccine pop-up at the Mall of Louisiana in the former William Sonoma store on the first floor. It opened yesterday, and it'll be open tomorrow as well, today and tomorrow, from 11 a.m. to 7 p.m. And then on Friday and Saturday, May the 7th and May the 8th, it'll be open from 11 a.m. to 8 p.m. I'm also excited to announce that today we're launching a feature on LA Wallet that will allow you to access your COVID-19 vaccination record if you choose to do so. LA Wallet is Louisiana's digital license app, and it is optional and free and easy to use. And I've enjoyed seeing how excited people get about receiving their COVID vaccine card, but inevitably, some of us are going to lose them and need to replace them. In fact, that's already happened. And many people just prefer having the option of a digital record. Again, this enhancement to LA Wallet is free. It's a secure way to access your own personal health information. And if someone wants to have a digital copy of their vaccination record, they should be able to do that easily and at no cost, which is what this optional feature at LA Wallet allows. So if you don't already have LA Wallet, you can download it through the Apple Store or Google Play. At this time, I'm going to turn things over to Dr. Cantor for his updates. There are some exciting developments that we believe are coming in terms of younger people being eligible for the COVID vaccine. I believe it's going to be the Pfizer variety. He'll speak more about this, but I will tell you that we do expect to have this vaccine available to people with FDA and CDC approval in the near future. So with that, I'll give it up to Joe Cantor, and I'll come back in just a moment.
Good afternoon. Thank you, Governor. Thank you for your leadership, and thank you for your service as well. I also wanted to mention, in addition to Interpreter Recognition Week, it's also Public Service Recognition Week, and we have a lot of really devoted public servants in Louisiana that, particularly throughout COVID, have just been pulling way above their pay grade. So I wanted to give them recognition and let them know on behalf of myself and Secretary Phillips and the Department of Health, for all agencies that have been working during this public health crisis, that we really do appreciate what you do. And thank you for that. Our COVID numbers in terms of epi numbers continue to be relatively reassuring, and I'll run through some stats right now. As of today, percent positivity of all tests conducted on the state is down from 2.8 to 2.7%. 6 out of 9 regions in the state have had decreases in percent positivity. The remaining 3 have had very small increases. We are now, compared to all 50 states, the 9th lowest in terms of new cases day by day, the 9th lowest in terms of percent positivity, and the 5th lowest in terms of hospitalizations of COVID patients per capita. All of those numbers, I think, are reassuring. We got here by doing the right thing. So let's keep it up. It's important to recognize that mandate or not mandate the public health recommendation for distancing, and particularly masking, and particularly when you're in settings with unvaccinated individuals indoors, is very much still there. The recommendation is very much still there. At this point, 14 odd months into this pandemic, we have a good sense of what is effective in keeping us safe. And for individuals, particularly unvaccinated in indoor settings, masking and distancing are highly effective. So I do want to encourage people, even though our numbers are encouraging at the moment, there is no guarantee that they stay that way. And I want to encourage people, first and foremost, to get vaccinated. Secondly, if they've not yet gotten vaccinated, those recommendations of masking and distancing really do apply to you. They can keep you safe. They can keep your family safe as well. The variants continue to give me concern. They continue to add urgency to the vaccine campaign. And every day that goes by is, each time the virus transmits from one person to another, there are small mutations that take place. That's a normal element of viral transmission. And 99.9% of the time, those mutations are insignificant and irrelevant. Every now and then, a mutation arises that is not irrelevant, and it leads to a variant of concern. The first and foremost way to reduce the chance of any variants of concerns in the future are to reduce transmission now, which can happen through masking, distancing, and even better than that is vaccination. We've been very fortunate that the variants of concern circulating now remain good matches for the vaccine. there is no guarantee that that maintains that way in the future. So we have this window of opportunity now that we really do need to capitalize on that. Similar to last week, of all COVID circulating in Louisiana, CDC is pinning 33.3% of all that COVID as the UK or the B.1.1.7 variant. That's a number that's been steady for the past 2 or 3 weeks now. As we announced a little bit earlier, we now do have the P1 or Brazilian identified in Louisiana. We now have a total of 7 cases of the P1 variant. Of course, this is a tip of the iceberg scenario where we still, as a country, do relatively little genomic sequencing of these viral samples. So when you have 7 identified cases, you certainly have more that you just haven't identified. Those 7 cases come from regions 1, 2, 5, and 6. That's the New Orleans region, the Baton Rouge region, the Lake Charles region, and central Louisiana. As a whole, across the country, 3.5% of all COVID circulating is the P1 or the Brazilian variant. We continue to have no identified cases of the B.1.351 or the South African variant. The governor mentioned top-line numbers for people vaccinated in Louisiana. It continues to be encouraging, yet we know we have a lot of work to do right now. There's been 2.7 million doses of vaccine administered in Louisiana. As the governor said, 32.4% of our population has now initiated the series, and 1.25 million, or about 27%, have completed that series, and encouragingly, just below 69% of those aged 65 and above are now fully vaccinated. And you can see that in those nursing home death numbers that we've shown previously, and certainly in our hospitalization numbers, which have been below 500 for a good few weeks now. All of that is encouraging. I want to let folks know that we have added some ethnicity demographic information to the vaccine, the LDH vaccine dashboard now. And you can now go in and see progress on people who self-identify as Latinx or Hispanic. That's added to the racial demographic information that's on the dashboard. So right now, of all vaccines administered in the state, 3.9% have gone to individuals in Louisiana who self-identify as Hispanic. Just to put that in perspective, as a population base, 5.3% of Louisiana identifies as Hispanic. So if you did back of the envelope math on that, we're at that 3.9% is 74% of predicted, what the population would predict, which I think is encouraging progress, particularly that it's a marginalized community here, but clearly we have work to do. The data completion on that is 69%. We have ethnicity data on 69% of every vaccine that's been administered. To compare that to national numbers, which I'd like to do, we're ahead of the curve on this. So nationally, this is according to the CDC, 12.3% of all vaccine administrations have gone to individuals who identify as Hispanic, and that group represents 18.5% of the U.S. population. So the U.S. is running 66% of predicted, a little bit less than Louisiana is. Even more notable is the data in Louisiana is much more complete than national data. Nationally, the CDC only has information on 55% of vaccine administrations. Again, we in Louisiana have data on ethnicity data on 69%. And I'll tell you, that really is as a result of the hard work of the public servants that I kind of gave nod to earlier on. So we have decent quality data, and I'm encouraged by the progress we've made in the Hispanic community. I know we have more work to do there. I do want to mention a new feature that's available on our Louisiana vaccine hotline, and that is the ability to bring vaccine to individuals who are homebound. This is an important service. Just because someone suffers with a disability or for other reasons is homebound, they certainly should be allowed to avail themselves of the protection of the vaccine, and that's what this service does. So the hotline number, which we've said before, and I'll say it again, is 855-453-0774. It's open till 8 p.m., 7 days a week. If you are homebound, if you care for someone who is homebound, you can call that number. We can take down your information and link you with a team that can come on site to your house and provide that vaccination. That's an important service. We've now had over 3,000 people call that hotline, and just over 1,100 have been connected with vaccine appointments. So it's still a valuable service to get information about the vaccine, to get connected with a medical professional if you have more granular questions, to actually have an appointment made for you at a vaccination site in your neighborhood. And now, if you're homebound or you care for someone who's homebound, we can actually bring vaccine to you. And we're very proud to offer that service. Looking forward, I do want to let folks know what our vaccine allotments are going to be, and I'll talk a little bit about a change in how the federal government is going to run vaccine allotments across the country. So for the current week that we're in now, we are allotted a total of 130,130 doses of vaccine. That breaks down to 69,030 Pfizer, 50,700 Moderna, and 10,400 Johnson & Johnson. For next week, we will be allotted 127,730 doses. That breaks down as the same 69,030 doses of Pfizer. I should say these are all first doses. That usually a second dose follow. An increase of Moderna to 51,900 and 8,000 Johnson & Johnson doses. What the federal government announced earlier this week is in response to requests from a number of states, they are going to make available to other states with higher demand any excess vaccine that is not ordered by a current state. The entire allotment will remain available to each state. Anything that's left after that unordered will essentially go into a pod and be distributed to other states that are seeing increased volume of vaccinations right now. By us, this sounds like a good plan, because if doses shouldn't be sitting on a shelf, they should go to use somewhere. And in the end, I think that serves everyone's interests. So for the past 3 weeks, we've not needed to order the entire allotment that has been available to us. There is enough vaccine for everyone in Louisiana that might want one. There is enough second doses on hand for anyone that needs it. This is truly just excess vaccine doses. And I'll tell you, cumulatively, Louisiana has ordered 81.8% of all vaccine doses made available to us by the feds. Of that, 99.7% has actually been delivered and in state. And of that, 73% of those doses have been administered into people's arms. Some other announcements that have come from the federal government this past week, they'll be encouraging walk-ins in retail pharmacies offering vaccines. So prior to this, it was a real focus on asking people to make an appointment. And what the federal administration is going to be doing, particularly to the large retail pharmacy chains, of which we have a number which in Louisiana, Walgreens, CVS, Walmart, Kroger, Berkshire's, for example, people will be encouraged, if they would like to walk in as a convenience factor, and that's encouraging. Also, as the governor mentioned, there's a federal text hotline to get information on vaccine sites near you sent to you. And the governor said it, I'll say it one more time. If you text your zip code to Get Vax, and that spells out as 438829, you will get spit back as a text message a list of vaccine providers in your zip code. It's a handy feature, a quick way to get some vaccine sites near you. The federal government also has a new vaccine finder site. It's at vaccines.gov. And it provides a very similar service. You could put in your zip code or your address, and it'll show you all the vaccine sites and who has inventory on hand near you. So all of those should make it a little bit more convenient for people to find out where they can get vaccine close to home. I'm very excited to learn that we have every expectation now that in the coming week, the FDA is going to likely amend their emergency use authorization of the Pfizer vaccine and extend it down to individuals 12 years of age and above. This is an exciting development. Pfizer had submitted data a few weeks ago for that age group, the 12 through 15-year-old age group, and the data they submitted was really encouraging. And of course, that's not all the data that's out there, and as both the FDA and the CDC meet next week, there'll be more data released, and we're looking forward to reviewing that data closely. But if it tracks along with what's already publicly available, it's very, very encouraging. The data shows high efficacy and great safety in the age groups of 12 to 15 with the Pfizer vaccine. So we do expect the FDA to make a decision on this early next week, and then we believe the CDC's Advisory Committee on Immunization Practices will meet a week from today, on Wednesday the 12th, to review and make further recommendations. What I would encourage people now is, if you have a child who's between the ages of 12 and 15, talk to your pediatrician now. Don't wait for this to come out next week. Be thinking about it, be talking to your pediatrician, get your questions answered. I think people have reasonable questions, very reasonable questions, and there's very reasonable evidence-based answers out there. Take your time now. If you have an adolescent or someone between the age of 12 and 15 in your house, see your pediatrician, talk to your pediatrician, get your questions answered. Put yourself in a position where once this authorization does come through, you're able to avail yourself very quickly of it.
First at 4, as you just heard, Governor Edwards updated the state on the fight against COVID-19. He outlines an easy way to keep a copy of your COVID-19 vaccine card safe. Plus, a place where the disabled and elderly can get a day out on the water right here in our own backyard.
And it's certainly been a nice day to be out on the water. Bright sunshine, light breezes, and lowering humidity make for a very pleasant evening. I've got more sunshine ahead for Thursday and Friday, but we are tracking some showers by Mother's Day. Your forecast is coming up.
Sponsored by Lake Charles Memorial Health System, covering the news for Southwest Louisiana. This is 7 News First at 4.
The governor wants to make it even easier for you to get vaccinated against COVID-19. Good afternoon, everyone. I'm Agnes Derwent. During his news conference, the governor announced a new effort to expand access to vaccination